How would you like to discover how to recover from addiction? Trent Carter will tell us how to do it. And what's so special about Trent is that after witnessing the urgent need for comprehensive addiction treatment in New Mexico, Trent Carter founded Renew Health, an innovative recovery center dedicated to saving lives and restoring futures through patient-centered treatment. So, Trent, tell us more about addiction recovery. What kind of
Absolutely.
addiction can patients recover from in your center? And what kind of treatments are provided in this center?
Heal Podcast with Lily Patrascu shares longevity and anti-aging techniques to stay young forever, increase energy, overcome addiction, and live your longest, best life ever. Shared by world's most innovative, alternative, and traditional health thought leaders, healers, and doctors. Discover quantum healing strategies to heal your mind, body, and soul.
Absolutely. Thanks for having me on. I'm excited to get to have this conversation. So we focus on substance abuse. So not so much the behavioral addiction, but the substance abuse and mental health that so often coincides with that. So your opioids, which would be your fentanyl, your heroin, things like that. Stimulants, so meth, cocaine, Adderall, and then alcohol. Those are kind of our bread and butters.
Thank you. So tell us more about the kind of treatment that is provided.
Absolutely. So I like to say that we're a full service. I'm a nurse practitioner, and so I really focus on the medication-assisted treatment, the medication side of it. That's, what it's going to do. It's going to help change that brain chemistry, right? We can reduce the cravings entirely. We can block the effects of these substances, these drugs, if someone were to go and use where they're not getting that rush. We also have therapists on board. So we offer cognitive behavioral therapy, the motivational interviewing. We've got CHWs, community health workers that are out there that they've walked this life, they've lived this life, and now they're 1 year, 2 year, 3 years abstinent. And so they're giving back and they're now working in the space as well. We help folks go through detox and withdrawal. So they're not doing it alone. They're doing it safely. It's managed under a medical provider. So it's going to be a lot more comfortable for them as well. And then we help with the aftercare too. We can help with skills and that transition to try to get back into the workforce or something like that for someone.
Thank you. So tell us, how long does it take for someone to start recovery from addiction?
Well, tough question. Everybody's different. It can happen very quickly. I mean, technically, it could happen within a few days, right? So if someone's using, let's say, fentanyl daily, and then they come in and we stop that, we get them to go through withdrawal, and then we start them on a medication such as Suboxone or naltrexone. Technically, they're in recovery at that point. And then it's the ongoing process, of course, that for someone, it may take many, many months or many, many years. It never truly ends. It's an ongoing thing for probably the remainder of their life. But that's where we tailor the treatment. We tailor our approach to that individual person.
Thank you. So, I mean, I've never taken drugs, but I have experienced withdrawal symptoms from an ex. So that I think could be kind of like similar to what a drug would be like. So I want to know more about like the withdrawal symptoms. What would kind of speed up someone's recovery? Or what would they need to do so they can recover faster than perhaps other patients?
Sure. So when someone's going to experience withdrawal, they're going to go through detox, it's because their body has formed a physical dependence on that chosen drug, substance, whatever it may be. And it's the nature of our bodies. So whenever we start introducing something to it that our bodies don't like, let's say alcohol, we're going to build that tolerance. And that's why over time, someone can handle more alcohol, right, before they start to act intoxicated. That's your body's tolerance towards that. And so when someone continues to do that, they build that tolerance and they drink more alcohol or they take more opioids, let's say it's heroin or something like that. They're going to, over time, form a physical dependence. And whenever they stop that substance, the alcohol, whatever it may be, that's when we experience the withdrawal. And depending on what it may be, it's always going to be uncomfortable, right? I mean, you can have physical symptoms, you can have emotional symptoms, psychological. I mean, it puts you through the whirlwind. But depending on what it can be deadly. Alcohol can be deadly. Benzodiazepines, so like let's say your Xanax, can also be deadly. So strongly encourage that to be done under the appropriate medical supervision with somebody that knows what they're doing. But as far as physical symptoms go, I mean, you name it, right? I like to say it almost feels like an intense flu. I mean, you can have vomiting, diarrhea, the headaches, cold sweats, muscle aches, chills. Literally, it hurts down to the bone, just extremely uncomfortable until you get over that hump, and then it starts to get better.
Thank you. So are you saying that people can die during the withdrawal phase? Did I understand correctly?
Absolutely. Yeah. So like let's talk about alcohol. Alcohol can absolutely be lethal if not done appropriately under medical supervision. So unfortunately, I know of several cases, not my patients, but just people that I know, that they tried to white knuckle it. They tried to do it at home and they ended up passing away because of it. I mean, their willpower was so strong that they tried to push through that, and unfortunately it ended up claiming their life. Whereas had they done it in a rather inpatient detox center, which for that individual that I was just talking about, it's where he should have been, or, under supervision of someone like me and what I do, they'd still be here.
Thank you. So tell us more about what makes the difference between someone who would, I'm not sure if to call it self-medicate, because it's maybe they're just like choosing to wean off the drug completely, and then ended up dying, versus someone who would be in the center. Is it that in the center, would they be given smaller quantities of the drug for a while to kind of reduce or what would happen that you think could lead to them kind of like, managing the addiction recovery better?
Yeah, great question. So certainly there's plenty of cases for people that do it at home and they've maybe got one of their friends helping them out or something, and they start to wean down, and maybe they just take a little bit of alcohol here and there to help fight off the detox, and they drag it out over several days. That is not the appropriate way to do it. While it's happened countless times, who knows how many times, and people have absolutely successfully gotten through it, you should do it with medications, right? And especially if you're severe enough that you need to be in a like inpatient setting, right, where you've got 24/7 supervision to monitor that detox. They're going to be giving you fluids to make sure you're well hydrated. They're going to be giving you medications to make sure that you don't begin having seizures, and it's called DTs, delirium tremens. You can have seizures and hallucinations and all these things withdrawing from alcohol. And again, that can be very, very dangerous and even deadly. You can have heart problems. You can have cardiac arrhythmias that can cause a heart attack, and you can pass away from that right there. And so all these things, you'd be hooked up to monitors. They're checking these things, making sure that you're safe. And again, giving you the appropriate medical treatment right then and there when or if you need it.
Thank you. What else would you like people to know about addiction recovery, the process of it, that you think it's important for people to know?
I think it's important for people to know that it's possible. Look, if you're somebody that's struggling, or you just know somebody that's struggling, you're seeing, it in your community, these folks are struggling. Look, recovery is possible. I see it day in and day out. Thousands of patients at this point have I personally treated and seen successfully get on the other side of that. And so there is a very safe, effective treatment that we have out there. And I think that if we can try to have a better understanding of that, lose a little bit of the judgment, right, break down some of that stigma that we so often see, then we can help these folks out. And then they can be productive. They can get their life back. They can actually take care of their kids. They can hold a job. They can go back to school. They can do all these things that so many of them truly do desire to do, but they're gripped. Their brains are hijacked. They're gripped by whatever that chosen drug may be. And at a certain point, it's no longer a choice. They truly have lost the control. So I think that's what I'd like for people to know.
Thank you. How effective would you say is the addiction recovery process in terms of like percentages? Would you say how many people tend to like recover out of 100?
Well, I don't have the exact number there. I can tell you that it's certainly not 100%, but literally nothing, right, in medicine is going to be 100%. Would I like the rates to be higher? Of course. But maybe if I could twist that question just a little bit and compare it to, say, other treatments that we have in medicine, I can talk about how effective it can be. So we can look at other medications that we have for high blood pressure or high cholesterol, whatever. Any medication we're going to look at, we're really looking at two things for it to see its effectiveness: is all-cause mortality, all-cause morbidity. So is the medication going to work? And in the meantime, is it going to do harm to that person, right? So that's kind of the full picture success rate that we look at for any medication. And for example, Suboxone, which is a medication we use for folks that are struggling with opioids, so your fentanyl, your heroin, Percocet, hydrocodone, things like that. It is one of the most effective medications on the market. You can put it up against just about anything, and it's going to blow it out of the water as far as effectiveness. So if we can get folks in treatment and actually get them going on treatment, the chances of success at 6 months, 12 months, 24 months can be really, really high. And again, I see it all the time.
Thank you. How important would you say it is for people to come to an addiction recovery center versus being at home if they have no resources to do so? Like, what can they do if because, for example, I'm from the UK, okay, and in the UK, you have the National Health Center where you can have like public health care. And I'm not sure what the system is, for example, in the US, but how affordable and accessible is, the access to an addiction recovery center like the one you're mentioning? Is it for everyone, or is it like ultra expensive? Can only certain people afford it?
So I'll start by saying that there's countless folks that have not gotten formal medical treatment, and they've successfully been able to, kick the habit or kick the drug, right? And gotten through it. And now it's been 10 years, 30 years, however long, and they did it on their own. And for those people, look, I commend you. It's incredible. It's awesome. Now, for someone that's on the other side of that isn't going to be able to do that by themselves, and you mentioned resources, right? Maybe they don't have a good support system or whatever it may be, then yes, I'm going to strongly, strongly urge medical treatment by an expert, right? Which is like what we do here at Renew Health or whoever it may be that's local and near to you. And then as far as cost, I would say well over 90% of my patients are Medicaid, and it does not cost them a single penny to come into my clinic, to see me, to get their medication, to get all the way through treatment from day one to 3 years later. It hasn't cost them a single penny except for maybe fuel or something to be able to come in which case we can also do telehealth appointments. But there you go. So no, it's not expensive. And if you're someone that comes in that has commercial insurance, and so you've got a copay, we work with you. Or if you don't have insurance at all, we still work with you, because if you're ready to take that step, you're actively wanting help. I can see you're wanting to change your life and make a difference. I'm going to do what I can to work with you and try to help you out.
Thank you. For those people that are on the path towards addiction, as in like they're somewhere in the middle between like becoming addicted and becoming like super addicted, is there anything they can do to like prevent the condition getting so bad that they actually do need to come to your center?
Of course. I think it's like anything in life, it's having awareness. So if you're noticing, hey, it's kind of getting out of hand, or hey, it's a little more than what it used to be. And we can come up with any example. I mean, let's talk about someone that, I don't know, maybe they hold a very, let's say a high paying job, right? For this scenario, we can have a pretty successful individual, but they get off work, they like to come home and they like to have a drink, whatever that drink may be. And a few years ago, it was one drink 2 or 3 nights a week, and then it turned into every night, and then it turned into 2 drinks every night. And now we're at 3, 4, 5 drinks every single weekday, and then on weekends is a completely different story. Like, you can see that progression, right? And in this scenario, which I'm just making up, but it's very common, it's very typical, then it happened in just a few short years. So having the awareness of how drastically that increases, and then you've got to take action. So you got to have awareness. You got to take action, which may be educating yourself. Hey, at what point is this getting out of hand? Just talk to Google or talk to AI at this point now, right? Find out what resources are around you. And then if you, in fact, still don't know, like, hey, am I on that edge? Is it too much? Is it not? Then talk to somebody. Talk to a professional. Talk to me. I'm going to tell you like it is, that's real. Like, hey, I don't judge. I don't shame. I get it. But let's talk about it. And I'm going to give you the honest truth. My opinion is, well, hey, look, this is starting to get out of hand. Let's look where you were 2 years ago compared to now. Is it affecting other parts of your life? Right. We'll go into this whole conversation. So there you go. I think awareness, education, and then taking action on it. But I think that falls into pretty much anything you want to do in life. If you want to get back in shape, same thing, right?
Thank you. Tell us the most concerning addictions that you've come across, and the ones that perhaps start relatively harmless. Is it the drink that you find is like the 90% of the types of addictions that come in? Or what would you say are the worst addictions that you've seen?
So any addiction can be harmful, right? Any addiction can be harmful. I would say the worst that I've seen, it's hard to say what exactly that means, but if we want to talk about overdoses and people dying, then fentanyl. Fentanyl is one of the most prevalent things that I see. I see a lot of fentanyl. I see a lot of methamphetamine. I see a lot of alcohol. But as far as overdoses go, then yeah, it's going to be the fentanyl. And that's very worrisome because somebody's dying that doesn't have to die. And so, again, having awareness of that and educating yourself. Hey, if you're going to use it, then learn about Narcan, right? It can save your life. Use with a friend to where if you are overdosing, they can give you the Narcan and then they can call emergency services, things like that. But then there's the addictions that are kind of insidious, like the example I just gave a second ago about the alcohol. It started one drink once or twice a week and kind of crept up over a couple of years. And now it's, oh, crap. I can't not drink because I wake up in the morning and I have the shakes and I got to take a little drink here to try to get rid of the shakes so that I can go to work. And then at lunchtime, I'm having another drink out in my truck. And then you can see that progression. And I see it all the time.
Thank you. What would you say are the types of things that cause someone to kind of become addicted to a particular substance? Would you say it tends to be like emotional struggles or like a traumatic event, like losing their job or losing their wife, or I don't know, something like that? Or what would you say are what, I don't even know what fentanyl is and why do people use it?
So there can be so many factors that play into this, right? I mean, even genetics can have a component here. If you grew up in a home where your parents were addicts or they were abusing drugs in front of you, you've got a pretty high chance of using, right? That environmental influence right there, which is what that would be. Or like what you just said, something traumatic. I mean, let's think about the 70 or 80-year-old individual that's been married to their spouse for the last 60 years and they just passed away and now they feel hopeless and depressed. And why am I still here? I'm in good health, but I don't want to be here. And then it's easy to want to start drinking because it's a little bit of an escape. Or pain. A lot of it is someone has legitimate pain and they're trying to manage that pain, but unfortunately that tolerance builds. And so they take a little more of whatever they're taking to manage it. And that tolerance builds. Next thing you know, it grips you and you've got that dependence and you didn't even mean to.
Thank you. So, it sounds to me like a lot of the medication that is being offered for addiction recovery kind of goes hand in hand. I think you mentioned in the beginning with some counseling and some treatment, emotional kind of like treatment as well, right? Can you tell us more about that? Like, what are the types of things that perhaps people can consider that haven't become like fully addicted, and they're just like on the verge of becoming addicted? Perhaps they can look at other kinds of treatment to kind of explore what is available.
Absolutely. So there's so many options out there. Most of what I've talked about is MAT, M-A-T, medication assisted treatment, which is the medication to help you out with it, right? But then there's the whole therapy and counseling side too. Or even if you don't want to do that, you've got like AA, right? Alcoholics Anonymous, NA, Narcotics Anonymous. There's so many options that are out there. So again, this is where having the awareness of something going on and then taking the next step to then educate yourself, acquiring new knowledge of what your options are. And then you can kind of decide, hey, this might work for me. This definitely won't work for me. And taking that actionable next step to actually try to put it into practice, into your life, into real world. So yeah, counseling therapy, we offer it at Renew Health, but I don't require it because I don't want to implement a barrier for someone getting treatment. If they say, hey, that's just not for me, I don't want to do that, but I'm willing to take this medication, I'm happy there. That being said, if we're not seeing the kind of progress that we want, or hey, we're seeing the progress, but anxiety and depression and all these things are happening with this individual because they've got previous trauma or something like that, I'm going to strongly encourage or lightly nudge them, just give therapy a shot. Worst case scenario, you hate it, you lost an hour of your life, right? Now you know. Best case scenario, you learned something and it works pretty good, and then you can go back and continue to work on yourself.
Thank you. Do you find it effective to replace the addiction for drugs or alcohol, whatever, with another addiction, like a lighter one, such as addiction to drinking coffee or having sweets, or I don't know, gardening, or making furniture in your garden? I don't know. Do you find that an effective habit? And if not, what are some positive habits and routines that someone can explore in order to recover from addiction?
So too much of anything can be a bad thing, right? I mean, here I am sipping on water, and if I drink too much water, I could harm myself. So do I recommend giving up one addiction and going full steam ahead on something else? Not necessarily. I think that there needs to be balance. I think that there needs to be moderation. That being said, if I can choose the lesser of two evils, meaning if someone's just, they're doing 35 pills of fentanyl a day or whatever, they're doing meth all day long, and versus, hey, now I'm going to really focus on exercise and education, and I'm going to take it extreme. I'm going to work out for 2 hours a day, and I'm going to study for 6 hours a day. I'm going to choose that over the fentanyl and the meth, hands down, right? Hands down. So when you put it like that, yeah, I'm going to choose that one over there. But again, balance and moderation. And so at first, if we need to go all in on something else to pivot our mind and pivot our focus, and then over time, right, as more time goes on and we acquire these skills and we're more comfortable, we're a little stronger, our mindset's in a better place, we can then start to get that balance and moderation, then that's fine too. Again, therapy, counseling, talking with a professional, something like that would help with that as well. You don't have to go at it alone.
Thank you. Have you noticed any of your patients kind of like taking up a replacement therapy of such kind, where they replaced like a really terrible addiction with something lighter? And if you haven't, tell us more about why did you get into addiction recovery? What was so exciting about it for you?
So yes, I've definitely seen it happen. I've had tons and tons of patients, countless patients, where they stopped one addiction or substance abuse that was more extreme, and then they picked up something else, whether it may be drinking. Hey man, I've never really drank in my life, but now all of a sudden I'm drinking. And so, hey, we need to get a hold of this too. But I'm, again, glad you're not doing 30 pills of fentanyl a day, right? You're not overdosing on a weekly basis. You're just having, I don't know, let's say even 5 beers a day. It's more than I want you to do. I'm not saying that, but I'm going to take that right now compared to where you were 6 weeks ago or 5 months ago. Tic Tacs, the little mint Tic Tacs, because it gives you something to do, especially for my drinkers. It's an act, it's a motion that they're doing, and they start thinking about alcohol and they'll do the Tic Tacs. And it's like, man, I'm going through 4 packs of Tic Tacs a day. Okay, we probably need to get a hold of that at some point. But right now, hey, I'm going to take it because you were drinking a 30 pack of beer a day. And then to answer the second part of your question here, how did I get into it? I personally, myself, I've never struggled with addiction or substance abuse. I don't have anybody close to me, like a family member or loved one or a best friend or anything like that that's ever struggled with it. I do this because I care. And I first got exposed to this type of patient population, this vulnerable patient population, when I was working as a nurse, registered nurse. And then whenever I went back to school to become a nurse practitioner, I took care of a few patients that were struggling with opioid abuse, so your heroin, fentanyl, things like that. And I just latched on to see the drastic change that they could make so quickly, literally turn their life around at what felt like overnight. And then to see how appreciative and thankful they were. It's just a great feeling. It's really hard not to fall into that and enjoy that. And I just became passionate about it. And so I jumped in with both feet and I opened my first clinic, and now we've got multiple clinics and we're statewide and we serve thousands of people.
Thank you. Is it part of the addiction recovery treatment to empower the patients to kind of create new routines that are not necessarily addictive, but something positive that they get to do? And if yes, what kind of really great habits and routines would you recommend someone to take up that will only get them to feel better overall?
Yes, I love that you brought this up. So I recently, I don't know if you knew this or not, released a book called The Recovery Tool Belt about a month ago. And this book is all about empowerment for that individual. And I talk so much about structure and routines, daily routines, weekly routines, things that can hold you accountable. I feel it is so important in recovery. And again, I really think any part of life, okay, anything we want to talk about, any topic you want to touch on, I can make an argument on why that would be important. But especially for somebody going through recovery, it's setting this new foundation and having that structure and those routines and something to hold you accountable, I think is going to be huge. And so my approach is to empower that individual, to give them these new tools. That's why it's called the Recovery Tool Belt. Newfound knowledge, education, tools, medication, therapy, whatever it may be, to where they can then act upon this. And so that kind of goes back to what I kept saying here, where it's having the awareness that there's a problem, but then the next two steps were educating yourself and taking action. So educating yourself would be perhaps reading this book or talking to me. But then once you get these new tools, you've got to put them into your life. You've got to put them into practice and take those actionable next steps.
Thank you. Can you give us some examples of some great routines that you're talking about in your book for empowering addiction recoverers?
Yep. So I'm all about making the routine fit the person as opposed to making the person fit the routine. If I try to change your entire life, it's probably not something that you're going to stick with, right? And so, if it's waking up early to get some exercise in before the kids and the chaos of the day, well, I think that now you've just started off with a win. It's going to be easier to go throughout the rest of your day. You've already accomplished something fantastic no matter what happens for the rest of the day, and you start off with a win. And then if it's, scheduling your appointments and your visits during your lunch break. And then if it's finding some time to, if you're into meditation, finding time to meditate or to journal, to reflect back on your day, I recommend that for the end of the day, because then we can look at the wins, where we failed, where we had successes throughout the day, and then we can adapt to try to change it the next day. And same thing for the end of the week. I like to reflect back on the week and see where we won and where we failed and what we need to do different. But then also having a plan moving into, you shouldn't go into tomorrow not knowing what's going to happen or what to expect. You shouldn't go into next week without having these things that you want to do, that you want to accomplish. And I think you need to schedule time for all that. That way you can reflect and again, see what you're doing good at and what you're doing bad at.
Thank you. I like to be a peak performer. Okay. And what I found is that one of the ultimate things that helps me become a big peak performer is to keep promises. And I think that when you're recovering from addiction, or when you're just simply want to be a better human, one of the core things about making this work is also keeping promises to yourself and to your therapist. And I think for people that are like me, like perfectionists, okay, there's no, like 80% is never good enough. It's not like, oh, if I kept to 80% of my promises, that's good enough. It's never going to be good enough. It has to be 100% or nothing. So I'm wondering about what can be done to kind of deal with this. Because, for example, for me, I find that I'm performing incredibly well as long as I'm keeping to 100% of my promises. But as soon as I fall off the wagon, where, let's say, I didn't go to the gym when I said I would, I didn't keep to a really good habit that I promised to do, like waking up at 5:30 or whatever it was, that's when the entire thing kind of just collapses. So I'm wondering whether you were experiencing that with your addiction recoverers as well, where some of them may also be perfectionists. And as long as they're keeping to a regime and everything is like, working like clockwork, they could be working like clockwork for 8 months. But as soon as they have fallen the wagon one time, where they have taken drugs again, then it's, oh my God, so hard to get back on track. Did you discover the same concept with your patients?
Absolutely. Yeah, absolutely. So when someone falls off the wagon, right, they hit a bump in the road or whatever it may be, we can always learn from that. And that's my approach. Okay, let's dissect this a little bit. What happened leading up to? What plan did you have in place? Oh, you didn't have a plan in place. Well, there we go, right? Maybe we should get that next time. You can always take something away from it that we can learn from and that we can do better. And then also, a lot of times, even though it was technically a failure, there's some positive along the way. Even if it's, hey, look, you went 13 days without using. When's the last time you did that? Oh, it's been 7 years. Okay. Like, I understand that you've relapsed and we're back on it now, but you went 13 days. That's still a major accomplishment. And that's something we can work off of. And the fact that you're back in here now talking to me, right? These are huge steps that you hadn't done in the last, almost decade. So there's still positives that you can get through with that. And like you said, keeping promises, I use the word keeping you accountable, right? Accountabilities, same thing. So what are your rocks? What are your non-negotiables? I think that, especially starting off, if you give yourself 30 things that you have to do today, it's pretty high expectation. You're kind of setting yourself up for failure. I think that we need to have a more reasonable approach for someone that's just getting started. And again, we're talking someone that they're used to doing methamphetamine or drinking pretty heavy alcohol daily, right? And so let's start turning those into, what wins can we have? What's going to be important to you? If it is the exercise, if it is going to be family time when dinner rolls around, whatever, then let's just start with that. And once we can start to form this new routine where it's not a habit, it is just part of who you are, your routine, we can then add more on and add more on. And that's going to put more pressure on somebody, but it's going to hold them accountable. And these things become valuable to them. They don't want to lose that. It becomes something that can be somewhat of a motivating factor for maintaining sobriety and abstinence, because they become very, very valuable and very important to these people, and they don't want to go back to what they had before.
Thank you. What about the people that are, like I said, like perfectionists that feel a tremendous amount of shame and guilt, and they feel just really bad for messing up that like one time, even after, let's say, being okay for 2 years, for however many, months or whatever, and doing great. And then having like one fail where they are, off the wagon for like one time. And I think it's just the feeling of, first of all, like massive failure. How do you get them to kind of accept that occasionally they might do it and it's okay for them to, I'm not sure if you would even say that it's okay for them to do it, but, kind of getting them to accept that failures could be acceptable, or I'm not sure how you would frame this.
Part of growth. It's part of growth. That's how I frame it. It's, it can be acceptable. I mean, statistically, the odds can be stacked against them. For so many people, look, plenty of people are able to stop right then and they never touch again for the rest of their lives. And then they die 60 years later and they were, clean for the rest of their lives. But so many people don't have that journey, and setbacks, relapse or lapses, are part of their sobriety journey. And so I think that I just try to educate on that. We talk a lot about that. But the example that you gave of this perfectionist that's really, really just tough on themselves with super high expectations, I think that that's also where some therapist or some counseling is going to come in too. They're going to get a certain amount of that from me. We're going to talk a lot about these things and through these things, but I'm not a therapist or counselor. I'm a nurse practitioner. I focus on the medical side of it. And so I think that we would get someone that's got more expertise in that area involved for that individual too.
Thank you. Tell us where entrepreneurs can connect with you.
Absolutely. So I've got a personal website. It's thetrentcarter.com. The company I've mentioned a couple times is renewhealth.com, but I'm all over social media, LinkedIn, Instagram, Facebook, whatever. We're fixing to do a TikTok as well. And that's at the Trent Carter as well. And then if you're interested in so I talk about entrepreneurship, business. I talk about mindset. Obviously, I talk a lot about substance abuse and the medical side too. Or if you're interested in just the addiction stuff, then follow Renew Health NM. Then we post, multiple times a day about all things addiction, substance abuse, mental health. And then if you're interested in the book, it's on Amazon, The Recovery Tool Belt. You could also find it through my site too, but I think most folks are just going to go straight to Amazon and purchase there.
Thank you.
Follow me for more interviews with world's most innovative health changemakers to live your healthiest life ever.